Good morning. My name is Ogomegbunam Okpalannajiaku. So the first question is, why do you want to become an adult registered nurse? I want to be an adult registered nurse because I desire to acquire the necessary skills required to take care of patients and service users that I meet every day in my line of work. I am a healthcare assistant and a support worker who has worked in various NHS hospitals and private residential care homes. And I've come to realize that there is a knowledge gap in what I have, what I know, the skills I possess, as I administer care to patients and care users every day. So I believe that studying adult nursing will give me the required skills to do more in my line of work, since I work mostly with adults, to give me the required competence to be effective and contribute to the execution of the care plan. And this I must do, of course, with compassion, with commitment, with courage, and also to communicate effectively in order to achieve a great overall care plan and results. So that is why I want to be an adult registered nurse. Thank you. So the second question is, what are the skills and qualities that you possess that will make you succeed as an adult registered nurse? Okay. The skills that I possess is, number one, I think I'm an intuitive person. I have great intuition. So because of that, I am able to anticipate and quickly anticipate a behavior or a response before it becomes an issue. Now, this is very important when dealing with patients. I'm also compassionate and emotionally intelligent. And because I'm going to be working with adults irrespective of background, it will be needed every time I'm dealing with them, because in communicating care plans, what is needed to be done, they need to understand, and you also they need to know that you've got their back. I'm also a very good manager, which is so I'm able to allocate adequate time to each person so that everybody will have adequate care. I have a great sense of humor, which comes handy when you need patient cooperation to deliver the best care. I'm also very resourceful and a good creative problem solver. It could be a TV remote that's spoiled and is upsetting a patient or a resident. It can be anything. It can be locating a personal belonging. So ability to be resourceful is a great quality that I possess that will help. I'm also good at communicating information with the team, the patient, the residents, and their family. And I'm an active listener who approach tasks with confidence to deliver my very best. So that is why I believe that I will make a very good adult nurse. So the third question is, what do you understand as the role of an adult nurse? Okay, in my own understanding, an adult nurse is supposed to work with adults of all ages. So this will now involve building trust, a trusting relationship with each patient, improving the quality of their life, juggling many priorities to get the very best possible results for them. And I also know that I'll be working with adults of all ages who suffer from chronic illnesses like cancer, sometimes kidney failures, arthritis, pneumonia, even accident injuries. So I know that I have to, develop care plan, implement tasks such as treating of wound, preparing patients for operation, administering medicine, drugs and injections, set up drips and blood transfusion, and so many other things, and also response to emergencies. I also know that I'm going to be working with it's a multidisciplinary team, such as doctors, radiographers, healthcare assistants, pharmacists, and I'll also know that I'm going to be working closely with patients and their families, which is very important. And the families, I will need to, have the family confidence that their beloved one is getting the best of care. So this is what I understand as my role as an adult registered nurse. So the fourth question is, recall an incident where communication skill was necessary and you were able to deliver. So I recall an incident that happened some time ago in one of the private residential care home that I've worked with. So a female resident that I've been familiar with was a little off that day. She was late chatty, she looked weak, and she has been demanding to use the toilet a lot. So I tried to initiate conversation with her, and it's not sounding like her at all. And I got worried, and I approached the nurse in charge, and I explained to her that there's something wrong with this resident. She's not her normal self. So luckily the nurse walked with me to the resident, and we asked some questions. And also in the course of that, I also made mention of the fact that the patient had been using the toilet a lot. So the nurse took her vital signs and asked me to continue to monitor closely. It was later discovered that this patient has norovirus, and because I was able to communicate effectively on time, this virus was contained, and it didn't have such effect it would have had in the entire flow of the care home if for example I didn't observe, and even if I observe, I did not communicate on time. So this is one incident I can recall where my communication was able to lead to containment of a norovirus that would have become that would have gone out of control in the care home. Thank you. So the fifth question is the Stout question. Stout is asking, how can an adult registered nurse show empathy and compassion to patients like myself? Okay, so Stout from the question has a T6 spinal cord injury, which has affected his control of movement from his abdomen downwards. But luckily for him, his upper extremities is okay. So as an adult registered nurse, I know that Stout will be having problem with bowel movement. Because he's not feeling any sensation. Sometimes he will not know when he actually needs the toilet. So there is every possibility that he will have to, go on bed or so I have to show him empathy. And then as an adult, when someone have to do his toilet on bed, it can be a bit embarrassing for the person. So my job as an adult nurse is to encourage him and make him understand that it's not a problem, that we are here to take care of him. He doesn't need to bother about it. So I will help him with the catheter care, and also help him with his personal care whenever he have the bowel movements. And also I will also assist him because he is prone to fall if he leans forward. So I make sure that he has things that he needs around him, communicate with him, show him love, show him compassion, and make sure that he's positive about his recovery. from the TC injury. Thank you.